So in this lab, we'll be looking at our appendicular skeleton, which consists of your pectoral girdle, so your clavicle, your scapula, all the bones of your arms, and all the bones of your legs, and your os coxa right here. Okay, so now let's start with our pectoral girdle. So your pectoral girdle consists of your clavicle and your scapula. So there's two ends of your clavicle. As you can see, one end of the clavicle is more thicker and stouter, and your other end of the clavicle is more flat. So the end of the clavicle that's stouter and rounder and thicker articulates with your sternum. And the other end of the clavicle that's flatter and a little more sharper, doesn't really have a round edge, articulates with your scapula back here. So now if we look at our clavicle disarticulated, as you can see, there's two ends of your clavicle, two ends. One end is rounder, thicker and stouter. So this end would be your sternal end. And that articulates right there. Well, this would be over here. So this articulates with your clavicular notch on the manubrium. Our other end is your acromial end. The acromial end, which is flatter, thinner generally than your sternal end. And this articulates with the acromion of your scapula. So this right here is the acromion of your scapula. And as you can see, that's what the acromial end of your clavicle is articulating with. There's another little process or another little tubercle proximal to the acromial end of your sternum, and that's right here. This process right here is called your conoid tubercle. Conoid tubercle. Another thing to note is that your clavicle is this S-shaped structure. This S-shaped structure. So you have the acromial end, the sternal end, and the conoid tubercle right here that's proximal to your acromial end. So what I've done here is I've turned our skeleton around so we can see our scapula. So this would be your scapula and also that right here. So if this would be looking at your posterior part of the scapula, so the posterior scapula, and if we turned it around and looked at it from here and the rib cages were gone, then we'd see the anterior side, this side. So let's start with our anterior side of the scapula. So let's start with our borders. This is your medial border. Medial border. And this right here would be your lateral border, lateral border. Now, if we look at it from here, you have your medial border, which is pointing medially, and your lateral border, which is pointing away. Okay. So now we're looking at the posterior scapula again. And here we have the spine of your scapula, the spine of the scapula, which ends up becoming your acromion. So the spine of your scapula leads to the acromion. You have another process coming up here. So again, this is your acromion. You have another process coming up here, and this is your coracoid process, your coracoid process of the scapula. So we have the spine of the scapula, the acromion, and the coracoid process of the scapula. We also have a few fossae over here. So we have our supraspinous fossa, which is above the spine of the scapula. This is your spine, this is above, so this would be your supraspinous fossa. This right here is below the spine of the scapula. So this would be your infraspinous fossa. And this whole fossa On the anterior side is your subscapular fossa, Another thing we can see here is this right here. And this would be your, I think it's better over here, your suprascapular notch. Your suprascapular notch, which goes from your superior border. So again, we have the medial border, lateral border, superior border, and your suprascapular notch. And I believe that is everything for your scapula. So again, this would be your posterior part of the scapula, and this would be anterior. So posteriorly, you can see the spine of the scapula and the acromion coming off. Another thing that's important is right over here. So all of this is how it articulates. Your lateral angle where all these processes are coming off are pointed laterally. And then you have this one little cavity right here, which is called the glenoid cavity. This holds the head of your humerus. So right here would be the glenoid cavity, and this is the head of the humerus. So your glenoid cavity right here holds the head of your humerus. Now, if we even look at it from this perspective, I want y'all to be able to label everything. So again, our lateral border, your glenoid cavity, your coracoid process, and your acromion right there. Okay? Okay, so now let's start looking at the bones of our arms. So let's start off with our humerus. So this right here that I'm holding would be the anterior part of your humerus. So the anterior part of your humerus. Okay. So here we have the head of your humerus. All of this is the head of the humerus. If you just made an incision around the head of the humerus, so all of this, that would be your anatomical neck. If you made right here, if you cut all of this off, this would be your surgical neck. So head of the humerus, anatomical neck, surgical neck. Now we have two tubercles right here. So this would be your greater tubercle, and if you go around, you can see how large it is. So greater tubercle, this would be your lesser tubercle, and the little sulcus in between it would be your intertubercular sulcus. If you move down a little bit, you see this roughened edge, and this right here is your deltoid tuberosity, Now, if we're moving more inferior, we can see a few more features. So this is your medial epicondyle, and this is your lateral epicondyle. Notice that the medial epicondyle is a lot larger than your lateral epicondyle. This right here is your trochlea, and this right here is your capitulum. So this is your trochlea, this is your capitulum. Now, if I turn this around, posteriorly, all of this is your trochlea because your capitulum kind of ends right there. So when I make that line around, this whole thing is your trochlea. And this fossa right here is your olecranon fossa. So as you can see over here, your trochlea articulates with your ulna, and your capitulum articulates with the radius. Okay, so this bone right here is your radius. This is your radius. So the radius has this circular head. It has that perfect circular head. The ulna, on the other hand, has this U-shaped screwdriver wrench looking head. So your radius has the circular, your ulna has a C moon crescent shaped head. So radius, as we mentioned, this is the head of the radius. Here we have the neck of the radius, the neck. This roughened portion right here, all of this roughness, is your radial tuberosity. Radial tuberosity. And if we look a little more inferiorly, this is what the inferior end of your radius looks like. Here we have the ulnar notch of the radius. So this would be your ulnar notch of the radius. And down here we have our styloid process. So head, neck, radial tuberosity, ulnar notch, and your styloid process. Now we're looking at our ulna. Look at the head of the ulna. It's this U crescent shaped looking thing, and this right here, this whole thing is called your trochlear notch. Remember the trochlea in the humerus? So the trochlear notch of your ulna articulates in here. Actually, it's like this. Okay, so your trochlear notch. The pointy back part of your trochlear notch back here is called your olecranon. Your olecranon. Remember, we also have an olecranon fossa in the humerus. So olecranon, trochlear notch, olecranon. And that's the pointy back part of your elbow that you can feel. Okay, the trochlear notch also has this pointy surface, and that's your coronoid process. Coronoid process. Here we have the radial notch of the ulna. Remember, we had an ulnar notch in the radius, but that was inferior. The radial notch of your ulna is superior. So this is the radial notch. And finally, inferiorly, you also have a styloid process of your ulna. So just to, once again, to recap, we have our trochlear notch, our your olecranon, your coronoid process, your radial notch, and your styloid process. Okay, so that's everything for your arms. For your hands, if we look here, you have your carpals, which I'm not going to ask you to memorize each of these names disarticulated, but if I gave you a picture of a hand and just shaded one bone, you should be able to identify that. So your carpals, here you have your metacarpals, metacarpal 1 through 5. And then you have your phalanges. So you have your proximal, middle, and distal phalanges. And remember, your pollex or your thumb only has 2. So it has the proximal and the distal phalange. Everything else has a proximal, middle, and distal phalange. Okay, so now let's look at your pelvic girdle. So right here, we have your 2 coxal bones, which are also known as the os coxa. And right here, we have your sacrum, So the joint between your sacrum and your os coxa is known as the sacroiliac joint. Sacroiliac joint. So right here would be your sacroiliac joint. Now let's look at disarticulated os coxa. Okay, so here is a disarticulated os coxa. And here, all of this we're looking at is your ilium. So all of this is the ilium where I'm touching right now. Your butt bone, or the bone that you're sitting on, is your ischium right here. And then this over here is your pubis. So you have your ilium, your ischium, and your pubis. So this is how your os coxa is located anatomically. So this would be your anterior part of your os coxa, and back here would be posterior. So now if we're looking just at your ilium, all of this up here is your iliac crest, iliac crest, iliac crest. In here is your iliac fossa, the iliac fossa. Anteriorly, we have our anterior superior iliac spine. So remember, this is the anterior side again, and it's up. So anterior superior iliac spine. Here we have the anterior inferior iliac spine. Back here, because it's a posterior side, remember, posterior superior iliac spine and posterior inferior iliac spine. Now if we're looking at our ischium, so this would be all of this, your ischium. So this right here, since it's part of the ischium, right, it's part of the butt bone, this is your ischial spine, your ischial spine. And now we're looking at the pubis, pubis. So here are the two rami of your pubis, and over here would be your pubic symphysis, where your os coxa, if I bring this down just a tad bit, where your os coxa, the two pubis bones are coming together. So this right here is your pubic symphysis. Well, one thing I forgot to mention is that this big hole right here in your os coxa is your acetabulum. This is where the head of your femur, right here, as you can see, the head of the femur articulates. So this whole thing right here is your acetabulum. Okay, so now we're looking at our femur. So here, this whole bone that you can see is the femur. Okay, so this entire bone is a disarticulated femur, one of the biggest, strongest, largest bones in your body. So right here, this whole thing is the head of the femur, the head of the femur. This right here is your neck, the neck of the femur. We have the greater trochanter and the lesser trochanter, which are connected by this intertrochanteric line. You can see that little line right there, intertrochanteric line. We also have the small indentation in the head of the femur, which is called the fovea capitis. Everything else over here is the shaft of the femur. There's specific lines within here, but I won't ask you to memorize them because it's a little hard to see on camera, but all of this is the shaft of the femur. And then we have some condyles and epicondyles, just like we did in the humerus. So this is your medial condyle, and this is your lateral condyle. Medial condyle, lateral condyle. Between the two condyles, you have an intercondylar fossa. So medial condyle, lateral condyle, intercondylar fossa. You also have your medial epicondyle and your lateral epicondyle. Back here, if we look, again, we see our medial and lateral condyles. So that whole thing right there is your femur. Okay, so this bone, this entire bone right here is your tibia, your tibia. So this is the anterior tibia, and if I turn it around, this would be your posterior tibia. So anterior tibia, we have this big sharp crest. I think if you even feel your leg right now and you feel the sharp crest, that is your anterior crest. So this entire thing is the anterior crest. Now let's look at the head right here. So we have the medial condyle, the lateral condyle, And these little structures right here is your intercondylar eminence. So these little structures in between the condyles are your intercondylar eminences. So medial, lateral, intercondylar eminences. If we look right here, we have this roughened surface. So this right here is your tibial tuberosity. Now, if we keep going down, you see this little piece of a bone that's pointing out. This is your medial malleolus. Medial malleolus. So this whole thing right here is your tibia. Our next bone is your fibula. So this whole thing right here is your fibula. It's a lot smaller than your tibia. Here we're looking at the head of your fibula, the head of the fibula. The sharpened point of the head is called the apex of the fibula. And then we have the shaft, and then down here we have our lateral malleolus. Lateral malleolus. So in our tibia we had the medial, and here we have the lateral malleolus. Okay, so here we're looking at the bones of our feet. This bone right here is your calcaneus. Calcaneus, that's your heel bone. This bone right here is your talus. Your talus. Then you have your navicular. Navicular. This is your cuboid. And then you have your medial, intermediate, and lateral cuneiforms, which are your carpals. Then you have your metacarpals and your phalanges. And again, your thumb only has two, the proximal and distal phalange, and everything else has a proximal, middle, and distal phalange. Once again, I won't be asking you to identify the bones if they're disarticulated, but again, if you had a picture like this and I asked, for example, what's this bone, you should know that this is your calcaneus. And that is everything for your appendicular skeleton.